Hi, I'm Fee, one of the directors at Mayden. Rewired was the last event I managed to attend before the world changed. So it is with a level of emotion that I attend this year. It seemed so strange at the time to receive a bottle of hand sanitizer in the event goodie bag. Little did I know how useful that would become. This event is always one of the first on my calendar. And for my third time attending, I'm excited that the remote nature has given us at Mayden our first opportunity to exhibit. Welcome. So what do you need to know about Mayden? Well, we're probably the most widely used EPR that you may not have heard of. We currently work with over 100 NHS Trusts and CCGs. More than you thought, I bet. If you are curious and want to see if we work in your area, you can take a look at a coverage map in our download section. So what else do you need to know about us? Well, because of our coverage across England, our philosophy of interoperability, and our ability to create innovative, time-saving digital features as part of our iAptus EPR, we genuinely believe we save the NHS millions every year. Over the last 10 years, we have focused on developing digital tools to help services run with efficiency, and our customers have really embraced digital as a core part of their service. For example, our EPR allows online self-referrals, patients can complete their questionnaires from home, we integrate with digital health tools for remote treatment, and communications with GP practices is digital too. On top of that, we have some really exciting additions to our digital care pathway coming in just the next few months, based on machine learning algorithms which have been developed to gain insights from clinical data and use that to improve patient engagement, reduce DNAs, and help services streamline care. If you want to see the types of digital tools we've been creating and how they fit together to form a digital care pathway for a service, you can take a look over in our download section. One of the streams I'm most looking forward to attending at Rewired this year is the session about responses to COVID. This one's close to my heart because working with so many services across England, I really saw the impact of COVID on primary mental health services firsthand and at scale. I was blown away at how quickly our customers were able to respond to the pandemic and continue to treat patients remotely. And I think that this was, in part, due to the way that these services have really embraced digital before the pandemic hit. Because of these digital tools already being embedded in services' working practices, it became a case of them scaling up the use of things that were already in place. On top of that, due to customer request, we also integrated video into our iAptus EPR to support remote treatment, which we were able to do quickly because of our agile way of working. We were also approached by services in need of digital provision and were able to set up iAptus for a new service from a standing start in just 9 days, whilst they still operated. I'm really proud that we were able to help in that way. A key philosophy for us is that systems in the NHS need to be interoperable, so that care for patients can be high quality and consistent, and clinical processes can be streamlined for clinicians. A key part of our digital pathway is the option for remote treatment by CCBT providers. So our partner programme, which is allowing secure transmission of client data between EPR and digital health platforms, was crucial for primary mental health services during the pandemic. We are also working on some other exciting integration projects at the moment, which will be hugely beneficial to those working in the mental health sector in particular. So we can't wait to share that with you soon. If you want to find out more about our work around interoperability, you can see it in our download section. But the thing you need to know about us most is that we genuinely love to work with our customers, with partners, universities, other suppliers, and anyone with valuable insight into the needs of healthcare organisations, so that we can share knowledge and in turn help us make the best system possible. We would love anyone at the conference with views on how healthcare is going to change for the next decade to get in touch for a chat about what role tech will need to play in that. So please do get in touch with myself, Chris, Alison, Helen or Becky for a chat. We'd love to hear from you. Thanks for listening and enjoy the conference. Hopefully we will see you there in person in 2022.